Hi, my name is Sandra McClark. The topic I'm going to be discussing today is how to treat a skin cancer. I am going to inform you on the top 3 preferred treatments that are used today to treat a skin cancer. How many of you have ever had a skin cancer treated? Skin cancer treatment is a very effective way to get rid of the skin cancer. Skin cancer is on the rise as we speak, and to know the top 3 standard treatments to use today to treat a skin cancer is very important. I will talk about the 3 effective ways to treat a skin cancer and which is the better option to use. First off is Mohs surgery. Second option is electrodesiccation cautery. Thirdly is chemotopical therapeutic cream. We will discuss the process of Mohs surgery, which is commonly used on a basal or a squamous cell. Mohs surgery is considered a 99% effective rate and considered the gold standard treatment for treating a skin cancer. Mohs surgery is an outpatient procedure under local anesthetic. Mohs surgery was founded by a man named Frederick Mohs, which he considered a tissue-sparing procedure. Mohs procedure consists of taking a thin layer of what the doctor will mark in office, marked with marks, demarcating where he can notch it and keep an eye on the skin cancer once it is processed in the lab. Once he takes the skin cancer, the patient will wait about 30 minutes to an hour while the tissue processes in the lab. The lab will look a lot like this in a Mohs laboratory. It will consist of a cryostat along with a tissue staining that will process the tissue, and it takes about 8 minutes. He will then look at it under the microscope and determine whether if it is still positive, and if it is, he still has to go in where he notched it to locate where the skin cancer is still positive and keep taking it until he can clear it, until he can get it cancer free. On to our next field of treatment is electrodesiccation cautery. It has a 95% effective rate and is also done in office under local anesthetic. Electrodesiccation, also known as EDC, is used to scrape the skin cancer down to the dermis using a curette. This green long stick with a circular, very sharp end to scrape the skin cancer down to the dermis. The doctor will proceed this in 3 cycles, bifurcating it at the base until he gets to the dermis, using this, bifurcating, using the curette within the 3 cycles. On to our next standard of treatment is the chemotopical therapeutic cream. This is not considered a gold standard treatment. Chemotherapeutic is 80 to 90% effective. Chemotherapeutic also has some alternatives using it. The cream causes redness, irritation to the skin that is commonly used with precancer cells. Usually the top chemotherapeutic cream that is used is Aldera, which causes the redness. We recommend keeping Vaseline on the treatment area until we usually use this for about a month to consider treated. They will then stay in touch with us for about 6 months to a year to keep an eye on the area to make sure there's no reoccurrence of the area due to this not being 80 to 90% effective. So as you can see from these example givens, which are the 3 most common treated and which would be preferred method for you to use. Now wrapping it up, I got all my resources from the 3 most effective ways to treat a skin cancer, choosing the best option to treat a skin cancer. The first place I looked on the internet was Mohs surgery, top standard of skin cancer treatment. which I found that on skincancer.org. The second place of my info that I found was on www.epatientdave.com, where I found the effective ways to treat a skin cancer. He gave in-depth details and statistics used to treat a skin cancer. Thirdly, I used a verywell.com to discuss the treatment of chemo and how I got 80 to 90% effective rate. Thirdly, my last resource I found on the 3rd edition, Volume 2, Dermatology Surgery 2012. It was a Mohs surgery book that I used. I hope you found this speech very informative on how to treat your skin cancer. Thank you for taking the time out of your day to watch this video. Thank you.